everyone, and welcome back to Shattered Silence Stories of Recovery and Resilience. My name is Jori, and today we are here with Tracy and Mandy. They are here from Adventist Health, and they're here to talk about the Substance Use Navigation Program. Thank you guys for being here. So we'll just start. I'll have you guys introduce yourselves and then just kind of go over your roles at Adventist Health.
Okay, well, I'm Tracy Embry-Hernandez. I started out as a bedside nurse, and then I was the medical director. I have to start all over.
That's all right. That's all right.
My name is Tracy Embry-Hernandez. I started out as a bedside nurse at Adventist Health in the emergency department, became the director of nursing services for the emergency department. Did that for about 4 years, and I've newly accepted the position as the associate patient care executive.
Oh, awesome.
Hi, I'm Mandy Herrera. I am the project manager of community health at Adventist Health. I started there as a substance use navigator and then transitioned to the project manager of community health for our emergency department programs and our hospital programs there.
Awesome. So what has inspired you guys to work substance use and recovery care?
So my inspiration is multifaceted. As a nurse, I saw a lot of challenges with substance use with patients, whether it's alcohol, methamphetamine, opioid abuse, and a lot of stories that touched my heart. I also have a personal connection with a son who struggled with addiction for greater than 30 years at this point in time.
Okay.
So it's twofold for me, and I do believe that every human being deserves the opportunity to recover. There's someone's child, there's someone's loved one, their brother,
absolutely.
husband, any of those things. So it just touches me in a different way. I've seen a lot of really bad things happen in the emergency department and through my own life.
Yeah, I can only imagine.
I guess if you were to ask my why, Jori, I'm a child of addiction, so I've seen what addiction can do firsthand, but I'm a mother in this community, so when I tell you addiction doesn't discriminate, I mean addiction doesn't discriminate. So getting a chance to work at Adventist Health in our own community to see the people and help the people that need help, not just people that are unsheltered from our streets, but these are school teachers, these are kids that my kids play football with. So just being able to give back to my community and reduce that stigma to make sure that people get the care they need to start that autonomy of their own recovery.
Yeah, absolutely. And like, I mean, we talk about that all the time too, even with like Kyle, it's like it really can touch anybody.
Yeah.
Like addiction can hit anybody. Why is the emergency room such a critical place to intervene?
Well, the emergency room is really primary care. In today's world, everyone either has to work. So if you're working, you're not making it to the doctor Monday through Friday. So if something's wrong, the emergency room is where you go. A lot of our community lacks insurance. There's a lack of insurance. So you can't go to the doctor. You can't go get medication. So you come to the emergency room. And the emergency room is every walk of life, every population from our community. You will see everyone walk those doors, and that is the time of need. So the emergency room is the best place to start.
I would add that it's oftentimes the most vulnerable, right? If they've just overdosed and someone has provided Narcan either in the streets or prior to arrival, or even if we're placing them on the Narcan to assist with saving their life, because opioids obviously it prevents people from breathing. So obviously without the breath and life. But it's the point in time where you can potentially reach them, where they are the most vulnerable, and they may be at the moment of, I do want help. I do want to recover. I'm tired of this life. I almost lost my life. So it's finding that moment in time that is often one of the biggest opportunities for us to reach them and connect them with the services that they need.
Right. Can you guys explain the bridge model to someone who has zero medical background? I have no idea what this is.
So the bridge model was started probably 6 years ago in the state of California to get substance use care into our emergency rooms where, as Tracy said, people are the most vulnerable, where people need the most help. So the bridge model is really about treatment, getting them if it's some kind of medication assisted treatment for opioids. But then it goes deeper than that. It goes to other substances, methamphetamines, as Tracy said, alcohol. And then after the treatment, you're going to get connection to community resources. And that's really where the navigator comes in. The navigator comes in to advocate for the patient in their treatment, to connect them to community resources. And then the last part of the model is really a reduction in stigma and a big harm reduction push. So that's why at Adventist Health Bakersfield, we have Narcan to give out to our community with no questions asked. That's when I got to the emergency room. I guess that last part for me, that harm reduction, reducing that stigma, was big for me. Words matter. I don't like labels. I don't like the word substance abuse because it's not abuse, it's use. I don't like the names that people get. So it was really coming into the emergency room and letting people know that addiction is a disease. You have people in the medical background, and I had no medical background, but I had Tracy who backed me every step of the way. But you have people with medical experience that know, hey, there's diabetes that needs insulin. Well, sometimes there's substance use, opioid use that needs Suboxone. There's people that need help. And just letting them know that everyone is a person. And so that was really big for me, that harm reduction, words matter. So that was the push that the model started with.
Okay. I feel like that's so important too, because it's just like having people that are struggling, just making them feel comfortable too, and not like just coming forth with like a judgmental perspective, you know?
Just seeing that someone cares. And sometimes people and deep in their addiction have kind of burned every bridge. They don't have a support system for just having someone advocate for you, speak up for you, especially in a place where if you're not medical and you're in a hospital, you don't know what's going on. You're going to trust whatever's being done. So having that little extra support is always nice.
Yeah, absolutely.
You know, the stigma reduction was our greatest challenge in the beginning, because every person that we work elbow to elbow with on a daily basis, so our healthcare teams, it was pretty significant in helping them understand, as Mandy pointed out, that addiction is an illness. And I remember my son, I had the pleasure of raising two boys. One was very ill with a medical diagnosis, and the other was very ill with a substance use issue, right? And the one son with substance use said to me one day, "Mom, why do you help him and you don't help me?" Right? Like, that's powerful.
Yeah.
And so, I can't believe I'm crying.
It's okay.
Helping nurses see the face behind the addiction, that they're there because they need help, was really a big challenge. And it was a beautiful challenge, right? And we stepped up to that challenge. I'm super proud of that.
Yeah, that's awesome. Aspire Counseling Services provides caring, personalized support for adults and teens facing mental health challenges. From group therapy to mindfulness, art, and even pet therapy, their programs are designed to help people feel better and build healthier habits. Teens can get the support they need while still keeping up with school and home life. You can reach Aspire at 888-585-7373. Okay, so we're just going to go back into like when they first come into the ER, walk us through what happens when someone comes into the ER after an overdose or that is in active opiate use.
I think it's really changed over the years. When I first started, I was a little timid. I'm not gonna lie. You're working with doctors, you're working with nurses, so I kind of would stay back until they saw the patient. Now I'm okay with butting heads. As soon as I see someone come in, they'll pop up on our board, or the staff has gotten so used to me, the medical staff, the doctors, the nurses, that as soon as someone comes in, either an opioid use, overdose, any kind of substance use, they'll say, call Mandy, call Mandy. So I try to see the patient, to see where the patient's at before the providers see them, before the nurses see them. So while they're working on a patient, getting them the medical things they need, I can start the next process of connecting to the services, seeing where they're at. And it's not easy. Not every patient is a, yes, I want to get services. Yes, I must stop today. I know it's cliche, but it's like, if I just get one, that's all that matters to me.
Yeah.
It's a trickle effect, right? It's a ripple effect. So if one person gets that services, then we can go from there. But really, once I see a patient, I just kind of meet them where they're at. I ask them if they want services. We kind of talk about what's available to them, and we go from there, whether it be the medication-assisted treatment, maybe it be an outpatient program or inpatient program, or maybe it's just giving them that Narcan if they say no. Hey, here's this Narcan because next time, and it's not always you. Like, you might not need to use it on yourself. You might never know where you'll need to use it. So it's just making that connection, building that rapport. That way I check on them through their whole visit. I do have a team of other navigators, so I make it really known to them to let the nurses know, the providers know, the patient know that, like, we're here for you. If it's just that you need a warm blanket and nobody can get it, ask for us. We'll go get it for you.
Yeah.
Just building that rapport, because maybe, and I've seen it a bunch of times, Jori. I've seen people that have come in all ages, and maybe it's their first overdose or it's their 20th overdose, and they're like, no. But maybe they remember that blanket or that turkey sandwich, as little as that. Or maybe it was just the fact that I said, okay, I'll always be here. They'll come back. And I've had patients come back. I take my business cards to the Narcan. I've had calls at 3 a.m. like, hey, I'm ready. I want to go to rehab. So it's just building that rapport. I think that's the main thing the navigator does. And that comes with the advocating for them. So we see them from start to finish, from the ambulance or from the moment they walk in the door till the moment we walk them out that door, or the moment we give them that warm handoff to whatever services they accepted.
That makes me kind of like a little emotional, you know, because I'm just like that. Sorry. Just giving people hope is such a, sorry. I didn't think I was going to get emotional, but I just really, people like you guys are just amazing, because I really think our community just needs that so much. And just giving these people that hope, even like you said, something small like that might seem small, like a turkey sandwich or a blanket, you know, it's like, but them being able to feel that love, you don't know what they're going through. You know what I mean? They might not have any support at this point, and having just a little bit of support, even from you guys, you know, I think that just goes a long way.
It really does.
And if we're being honest, the resource part of it is the hard part. So if you're coming in and you're in withdrawal, you're detoxing, or you've just overdosed, you don't want to jump through hoops. It's easier to say, forget this. I'm just going to go out and meet my dealer. I'm just going to go to the corner liquor store. So having someone help you navigate that process, which is it, and I've done it for 5 years, and there's still times that I can tell you I get frustrated with the resource process, especially in a town like Bakersfield or in a county like Kern County, because we lack resources. So being there, as you may say, holding hands with this patient to go through the phone calls or the assessments that they're going to have to do over the phone, it does give that hope, like you said, Jori, but it makes that process a little bit easier. So they know, like, hey, I can get through this. Because if you give someone who's in active withdrawal a phone and say, okay, answer these questions for 45 minutes, they're going to hang up a couple minutes later. So it's nice to be able to watch that process.
Right. Oh, sorry. I didn't think I was going to get emotional on that. But, like,
we're together.
That really is just, like, that really touches me, though. Thank you. Let's see. I feel like we answered that next question too. Why is it important to have a dedicated person that's going to help patients navigate their next steps?
I think the importance of a substance use navigator, I think in the very beginning, especially in a place like an emergency room. I mean, we've all been in the emergency room. It is not a place where it's high pace, it's fast volume. So having someone that can take time and not just focus on the medical need, but those supportive services that are needed, those next steps, as you said, Jori, is really important, because a medical person is going to come in, treat your medical needs, and say, okay, it's time to go. But if there's someone there to help you navigate those next steps, at least inform you what the next steps will be, a patient's not as scared. When you take away and you give that education, that fear lessens, and to help you go through those next steps is important. That hand holding, like I said, sometimes somebody doesn't want to go through those next steps because of the fear. So if you have someone, and I make sure myself and all the other navigators on the team at Adventist Health know every place that we refer them to, we know about that place. We've visited them. We've done outreach there. We've connected with those community resources, whether they be in Kern County. And sometimes, like I said, with the lack of resources, we do suggest resources outside of our community because we don't have them to fit the person's needs. So we've been to the places we refer, we've talked with those people. So just letting them know, like, hey, you're going to a nice place, or you're going to somewhere that cares. I'm not just sending you to some rehab or some residential program that's scary, that's just going to throw you in a corner and lock the door. So I think that support and lessening that fear with that education is really important.
Yeah, and just confidently knowing that you're sending them somewhere good.
Yeah. I mean, if I were to add to it as a bedside nurse, I've got 4 patients to care for, right? And this one has a need that maybe I don't have the time for when I'm juggling 4 full patients. And so having the support that is knowledgeable in connecting them. So because I don't have the luxury, if I'm managing multiple patients at one time, the luxury of sitting side by side with that patient and saying, it's going to be okay. I'm here to help you through this. There's a lot that I can offer you by way of resources, and let me share that. I may not have the time. So having that type of support in an emergency department is critical to the success of the program and the community, from my perspective.
Yeah, absolutely. Okay, let me just ask a question. How do navigators support doctors and the clinicians in the ER?
I think so. The providers, that was probably the biggest challenge, because when you go into any medical setting, you have providers of all ages. So you have providers that are older and maybe they've been doing medicine for a long time and they're not hip to the changes, especially with addiction. Or you have providers with personal bias, or even you have young providers that come in and they've never seen that, as a resident or someone coming in and this is their first assignment, their medical assignment. But as a navigator, not only do we educate the community, our patients, the nurses, but the providers too. It's not irregular for me to get a text message from a provider asking a question, especially when it comes to medication-assisted treatment. It wasn't something that was being done before the Bridge program because it was so taboo. It was so new. So I will have providers now that will text me a question about a medication that we do for medication-assisted treatment. I will give them some education on it, and I try to educate the providers as much as I can all the time, being that extra support for them, because like Tracy said, a bedside nurse has 4, a provider might have 16, 17 patients at the time, especially when it's busy, and we're the emergency room, so a lot of them are critical medical wise. So just giving that extra support to the providers, that extra education, and letting them know, like, hey, if it's not something you're comfortable talking about with the patient, I'll talk to the patient, or I'll go with you. That way, if the patient has questions that are not medical related, I can answer them. So building that rapport with the doctors was important too. Those providers, they make the ER run. The nurses are the nitty gritty, right? They're the reason the ER runs, but the providers are the one giving the medication, seeing the patients. But it is important as a whole team, not just the providers, the nurses.
Right.
The emergency room techs, everybody plays an important role in that patient. And I think it surprised me most when I had providers, because when I first came in, like I said, there was a little bit of pushback, like, this patient's taking up room in my ER, can't you just talk to them somewhere else, like in the chapel, something like that. But I think it surprised me most when I had providers or nurses or techs coming to me, people from our EVS, our environmental housekeeping crew, people from the kitchen, like, hey, I have a family member, I have a son, I have a daughter, can you help me? And I think that was the biggest, like, okay, now they know that, like, it doesn't discriminate. Like I said, addiction doesn't discriminate. Every one of us knows somebody that struggled with addiction in their life. And a lot of us know somebody who have lost their life to addiction. So just making that extra support for the providers was big for the navigator to do.
Yeah, absolutely. And I do feel like you were saying, things have just changed a little bit too. I feel like some people might, I don't know how to say it. I feel like we're talking about it more. We're getting more help for those that do have addiction problems, Yeah,
the stigma of addiction.
Yeah, it really is.
It's really, because people are putting those personal bias aside, the stigma. I remember I had a provider once tell me, well, I don't know anybody in my family that has ever had a problem with addiction. And I was like, maybe you need to reevaluate. I said, you're probably the person they don't come to for help. And I think it was like 3 months later, he came to me, he goes, you know what? I have this nephew. He really struggles with fentanyl. Can you help me? And I was like, oh, you.
Yeah.
I'm like, of course I can help you.
Yes.
So I think just that reduction of stigma, not putting labels on anybody anymore, and just kind of giving that compassion and empathy to everybody. And I think that's why Adventist Health flourishes in especially the emergency room department, like I said, because everybody now knows that, hey, we're going to give empathy, we're going to give compassion to everyone that walks through that door, whether it's a medical need or it's a supportive services need.
Right.
And that comes with a lot of work too. It's just helping the teams remember the face, behind the problem, if you will. Bringing it to the staff meetings and to the forefront, bringing them along the journey of discussions, right? So Mandy partnering with a team member, a healthcare team member, and just showing them what this looks like.
Right.
And I'll never forget that when we first started the Narcan distribution project, where Narcan's available to anybody that walks through the doors, that asks for it or wants it, and there was a car full of people that overdosed together. Some worse than others, and there was a boyfriend-girlfriend, and I remember I received the girlfriend. The boyfriend was much more critical, and I received the girlfriend, and she said, no, I don't need it. And she could see her boyfriend from where she was, where her gurney was, right?
Yes.
She was laying in the bed, and I said, I'm going to leave this with you anyway, because I want you to look at your boyfriend right this moment, right? And so as they ended up leaving, she then had what she needed to potentially save his life in the future. And she was much younger than he was. And I felt as though at some point in time that small effort may be life or death for someone that she associated. It was a car full of individuals, right?
So
you just
sad.
never know how it will play out in life.
And speaking of Narcan too, like I didn't realize that there was even these programs for a while. I think probably not until we started the podcast. And I had went to a local breakfast spot, and there was Narcan just sitting on the counter right there at the restaurant. And I was shocked. I'm like, am I reading that right? But I sat there and thought, and I'm like, you know what? We do have a lot of homeless people around that area, and it's everywhere, that places that you would not even think for Narcan to be, that it's necessary though.
They should be.
Yeah.
Right.
Yeah. You just really never know.
Yeah.
That makes me laugh, Jori. This morning I borrowed my son's car, my 17-year-old son's car, and I went to put my keys in his middle compartment, and there are 2 boxes of Narcan, and I text him and I was like, I'm so proud of you. And he's like, for what, Mom? I'm at school. I'm just doing what I'm supposed to. And I was like, for having the Narcan. He's like, well, you never know, Mom. You never know. And
I have chills.
And
You don't.
you don't, and it's a thing that it's, available in your ERs. You don't have to ask. For me, I think the biggest thing with the Narcan distribution project was like, okay, Narcan cost. If you get a prescription for Narcan, you have to pay out of pocket. And it's like, why? Why is that?
Yeah.
Why is it that we say we're struggling with this epidemic of opioid use and fentanyl use and deaths, and our overdose deaths? I know they have went down, and I'm very proud of that, but one is still one too many, right? So why is it that we struggle, but then we have to pay for the help that's needed?
Right.
And like you said, it's not just our unsheltered population. You might have someone whose 90-year-old grandma was given Norco because of back pain. Maybe she had just had hip surgery, and maybe she forgot and she took one too many of her Norco. That's what the Narcan's there for. That it's not just when we're driving down the street. It should be in every household. And I'm glad that we have the means to give it to our people as they walk through the door.
Yeah.
There was a story, I'll never forget this particular day. It was Super Bowl Sunday that I was working as a younger nurse, and we got a cardiac and respiratory arrest call, and it was an 18-year-old, and he was watching the Super Bowl with his friends. He actually didn't even live in town. He drove into town to be with his friends, and so it was a big group of 18, 19, 20-year-olds, and they were smoking marijuana. What they didn't know was that it was laced with fentanyl. And so this one young man obviously went into full respiratory arrest, and his friend had the wherewithal to call 911, and then ultimately he went down. So when EMS arrived, they had 2 young men down, but one had been down longer than the other. Ultimately, he did lose his life. He was brain dead from an anoxic brain injury, and had that young group of kids had Narcan available, they could have saved each other's lives, right? The second young man that went down, again at 18, he recovered fine, but now he's living with those events for the rest of his life. And the torment that I know it must cause, and watching families grieve through those processes, where a simple Super Bowl party turned into disaster, and Narcan could have been the answer.
Yeah, and I feel like that is also important to note, because most people think that, fentanyl is only going to be in these street drugs and whatever, and it's like, and I've heard a story like that before of it being in marijuana, where these younger kids might think that's
Safe.
the safer one, right? That's safe, but
It's not.
it's not. Yeah. It's terrifying.
Yeah.
Oh, I know. I'm like, I think about it all the time too. My son's only 3, but I'm like, just to be a parent, I'm just like, it just makes me so nervous, It's just, this world. Okay, I don't even know how to pronounce this.
Buprenorphine.
Yeah, thank you. Say it one more time.
Buprenorphine. Or Suboxone.
Suboxone's easier for me to
Okay,
say.
Yes.
At one point, my late fiance, Kyle, he was struggling, and he was on Suboxone for a little while. But, I'm telling you, I had no idea about anything. I really didn't know what any of that looked like. So what is Suboxone, and can you explain it in some simpler terms?
Well, I can explain a few things, then I can let Mandy share a little bit, but it really does lower the cravings. It does attach to the same receptors in our brain that opioids do, but it's a combination drug. So it has the Narcan, if you will, the naloxone. So it doesn't give the same type of high. So what it helps is it transitions. A lot of people liken it to methadone, which it's really not. I guess in some respects it is. But it helps people withdraw without the cravings and the severe symptoms of maybe nausea or vomiting, or just feeling ill all the time through the process of it's detoxing. It's just really coming off of the drug itself, the opioids themselves. So it's good. It's a very good way to transition from full addiction and down to eventually no addiction.
Right. And I've heard that, the detoxing itself is so incredibly hard. So this is something that can kind of help those, right?
It can. And we help our patients if they're in the emergency department and they're ready to get the treatment. We will discharge them with a prescription, a starter pack, if you will, and then connect them. That's where Mandy would come in and connect them with resources so they can continue their recovery with additional buprenorphine and then the additional resources.
I think when you're asking about Suboxone in layman's terms, right, it's a medication-assisted treatment. But being in the substance use treatment world, you'll know that the only 2 substances that can potentially kill someone when withdrawing are benzos and alcohol. But they'll tell you that when you're withdrawing from an opioid, you feel like you're going to die. You might not die, but you feel like you're going to die. So it's so much easier to say that, hey, I'm not going to go through this. I'm not going to feel like the worst I've ever felt. I'm just going to go back out there and take a pill or do what I need to do to get back to that level where I don't feel like I'm going to die. That Suboxone helps. It helps you feel like you're not going to die. It helps the withdrawal symptoms, like Tracy said, feel more manageable. I think forever my favorite story of a patient is I had a patient. He wasn't my patient. He was upstairs. He had overdosed. He was upstairs. I was going to make my way to see him, and he called the hospital from his hospital room upstairs and asked for someone to help him. They were discharging him that day. They brought him down in a wheelchair. I got to know this patient very well. He was going to have to start dialysis, be put on the heart transplant list from fentanyl use. And he told me, I'm at my rock bottom. My wife has taken my girls and she's left me. Like, I have overdosed one too many times. I can't do it anymore. So it's like, okay, well, this is what we can do. He had already been admitted for days. So we were able to check him back into the emergency room, start him on Suboxone, give him a prescription for 30 days. I kind of have asked the providers, like, hey, there's no point in giving them a prescription for 3 days because they're not going to be able to get anywhere in 3 days. Our pharmacies were going through a shortage. So when they were going through a shortage, it was like, come back. But this patient in particular, we got him a prescription for 30 days. I got him an appointment for a medication-assisted treatment clinic. So he had an appointment in, I think it was 17 days. So it was like, okay. Now it's been, God, I think the last time I heard from him, he's 3 years and 2 months sober.
Oh my God.
He's a great success story.
Great. Yeah. He walks. He's not in a wheelchair anymore. He goes to dialysis. He is back with his wife and daughters, and he'll tell you that Adventist Health, the substance use navigation program in the emergency department, helped us get his family back.
Gosh.
And I always tell him, no, you did that. And he's like, yeah, but you guys made it help. You helped that support. And so I just remember, like, he walked in. Well, he didn't even walk in. The nurse pushed him in a wheelchair, and he looked like death. But not anymore. Like, when he'll come check in the hospital, maybe for other things like his heart procedure. His most recently in their first heart procedure, or he'll send updates of him and his girls. He just took his girls to some concerts that they really wanted to see. So it's just the little things.
Yeah.
But there is a downside to that. He had a friend who was in active addiction. He referred him to me. He also referred a family member to me. The friend came in. We got him started on Suboxone, and it just didn't work for the friend. Unfortunately, that friend overdosed and passed away. So when I hear the patient, he advocates so much for Suboxone, and I don't know what it's like, right? I don't know what it's to feel like to withdraw from opioids and want to die, but I remember the faces of my patients who look like, hey, it's just easier for, let me go, just let me leave, let me call my dealer, let me go, just give me some kind of Percocet, give me some kind of medicine. And I'm like, no, let's try this, just give it a chance. So I think that just giving that chance, reducing that stigma around Suboxone, like, this medication-assisted treatment is not making it easier for people to get high, as you would say. It's not making it easier for them to overdose. It's helping them, just as insulin would help a diabetic patient.
Yeah.
So.
And we talked about how it kind of like trickles down, but I'm just thinking of this patient you're talking about and his experience with you guys, and just now him being able to advocate too, and get people to come to you. And that's like where it starts. And that's what makes me excited about, even just doing this podcast, to talk about it and to just let people know that there's hope, there's success stories, it's not all negative,
No.
So that, like you telling that story, just, it gave me chills.
Yeah. And our program isn't just opioids, right? It's substance use. And so and we have stories around alcohol, use. And Mandy shared a beautiful story not that long ago about a young father. We'll never forget him either. Yeah. Who has recovered from alcohol and got his family back. I think the more challenging substance for us to manage through with patients, but we've done it, is the methamphetamine addiction. I think that one's a little more challenging, but at the alcohol, there's been good success stories through our program.
I love that
as well. And alcohol, as Tracy said, it is hard too, because it's everywhere. It's fantasized. And so people don't know. I remember, like Tracy said, there's a story of a gentleman who came in. His 18-year-old daughter brought him in because he was deep into his alcohol addiction. He was suicidal, and his 18-year-old daughter didn't know what to do but call 911. So I sat with them and I talked to her, and Dad's actually 1.5 years sober now. And that was the first time in her whole 18 years that her dad had ever been sober. Oh, wow. And she said, this is the first time anyone's ever talked to us like we're human. Usually my dad's just shoved aside. I'm happy to report not only is Dad sober, but she is actually in school to become a substance use counselor.
Oh my gosh.
So she changed her career completely. And so
making me tear up way more than I thought I would today.
It's that ripple effect, right, Jori?
It really is.
It really is. It's not just that patient. It's our community. It's children. It's spouses. And like I said, there is that downside, like you said, right? There is that overdose, but there are those stories that you guys are bringing to light with your podcast that are brought to light at Adventist Health. They're brought to light throughout our community. Like, hey, let's not just become this other statistic. Let's go the other way. Let's change those statistics. So it's great that our community is coming together to finally put that spotlight, shed some education, because I think education will always lead to prevention.
Yeah, and I think such a big point there too is like, sorry, I got a little distracted. I think a big point is, like you said, this 18-year-old girl is feeling like no one's even talked to them like normal people, when it's like, this is so common. Why can't we help these people feel like they're being heard, and they can get help, But yeah, I love what you guys are doing, because like I said, I'm getting emotional over here.
I love to hear that the programs, that there's something out there, because for so long there just wasn't, and I feel
those
getting
hoops
somewhere, and especially with a program like this.
The hoops were hard for people to jump around because you don't know.
Yeah.
Yeah, it was a long time coming, honestly. It was getting through the rough spots first before we became successful, to be quite honest. And we do an overdose awareness campaign every year.
Yeah, you invited Shattered Silence that one year. Yeah, when we our first season.
Oh, yeah.
You just don't hear of hospitals getting involved like that. So I feel like this is unique.
Well, we have the mission of our organization is living God's love by inspiring health, wholeness, and hope.
Yes.
And so
I feel like
hope.
I always think of
And this is
Scott.
the hope. Yeah.
What's he called? He says we're hopeaholics.
Yeah.
Oh, that's fantastic.
There's actually a podcast called Hopeaholics.
Yeah. This is more about after discharge. Does your I don't know.
This is a good area to go into.
Okay. Does your team help patients? Do you guys follow up with any patients after discharge?
I do. We do. The team does. As I said, I have that patient from 5 years ago. I actually still follow up with my very first patient. Unfortunately, my very first patient is still in active addiction, but he will reach out or he'll come to the hospital. I have a lot of phone calls of just parents that follow up. I follow up just because I think, as I said earlier, sometimes in active addiction, you lose your support system. And I get a lot of no's. It's not everybody. Yes.
Right.
In a perfect world, everyone would come through that door and say, yes, I want services. Yes, I want to stop today. Not every patient is a yes. In the moment, like I said, some turn around later, but just kind of keeping that rapport, especially with my patients that are in their recovery, because I've learned through this job and through working through treatment, substance use treatment, that recovery is not easy.
Yeah.
It is not easy. There's temptations, there's triggers, there's life. Life in general is hard for people who had an unhealthy coping skill of addiction. So I think just following up, just checking in, and I can't tell you how many times myself or someone on my team is like, hey, I checked in with someone and they were like, oh my gosh, how did you know I needed to hear something from someone right now? So I think following up is really important. Just letting someone know that you care. And there's days that are so busy. There are days that when you'll see an average of 16, 17 patients for substance use in the ER. And there's days that someone comes in for something as little as chest pain or maybe a cold, and they hear someone say, hey, go get Mandy, or hey, go get a navigator. Or we have flyers, brochures, and they'll say, you know what, hey, I'm struggling. Or a mom or a son or a wife or a husband, fiance, they'll be like, hey, my person is struggling with addiction. Can you help me? And I've never said no. You don't need to be a patient. You can call me on the phone and we'll get you the services you need. And I think that's why Adventist Health is so prominent in that field, is because there's no barriers to like, oh, we're not going to help that patient because they didn't check in. I've met with patients at Starbucks outside or on the grass. It's just as simple as, I think, following up with someone, like you said, showing them that there's hope, giving them that compassion. Putting yourself in someone's shoes. Addiction's not easy. And I've seen, like I said, I'm a child of addiction. So I've seen children grow up without parents or incomplete households. And I think the worst part is seeing a child grow up without a parent because they've lost them to addiction. So I think just kind of giving that extra support, whether it's a phone call, a text message, an email, just a check-in. So I think that's important. It's a big part of what we do. Because it's showing people that people care.
Right. Yeah. And like we said before, it could be in a place where they don't have that support. So even just a simple text or phone call could give them that hope.
And we have a lot of unsheltered patients who will just come in to ask, like, hey, is Mandy here today? Or hey, is there a navigator? And it's a simple thing. Maybe it's just a sandwich, or maybe it's just a, hey, I messed up again. Can I check in? And I'm like, you can always check in. The emergency room doesn't turn anyone away regardless. So it's nice to be able to build that community with all that community and that connection with all people, all populations of our community.
With something more common.
You're like, it's just everywhere. Are there common life situations or certain age groups that you guys see more often?
I think when you ask that question, Jori, it goes into waves. I could tell you there'll be a wave of like a month or 2 months, we'll see nothing but fentanyl. Or there'll be a wave of adolescents. Around the holidays, it's hard on everyone. Around the holidays, you'll see a lot more patients come in with alcohol use that need help. Like I said earlier, it's just substance use is an unhealthy coping skill that people use to deal with either mental health or triggers or tragedies or traumas. For me, I think lately, there's a lot more elderly people, a lot more people with methamphetamine use. Methamphetamine is always prominent in Kern County. That's just kind of how the cookie crumbles, I guess you could say. but methamphetamine use has been high. Alcohol is always very high. That doesn't have any perimeters. But during the first of the month, the beginning of the month, I think when people get paid or they get their Social Security, that's when you see a lot more fentanyl. You see a lot more of the opioids. And I think it's because it's a cost thing, a money thing. But for me, I think it just really comes in waves. And then you'll have a week or so where you're very minimum patients. And for minimum, that'd be like 4 or 5 a day with substance use. And I'll have a nurse or a provider joke like, oh, you cure the community. And I'm like, no, I don't know what's going on, but we didn't cure anything yet. Because as I said earlier, one is one too many. So I think it just comes in waves.
Well, I think it's important that you brought up seasonality because there are seasons where things do increase. And I think the holidays really does bring out the inept coping, right? And the increase of whatever that substance of choice might be. So I think that's important to note.
Yeah, and I think even with seasonality, when we talk about that, it doesn't have to be like actual seasons. You'll see a lot more adolescents during finals week when they are struggling to make those grades right before summer, right before graduation. You'll see kids that are turning 17 who don't know and they're closer to 18, I guess I would say, and they don't know what their next steps in life are, and that's became a crutch. And I think that goes into the whole seasonality. Like, we're not just talking holidays, or we're not just talking the summer when it's hot. You're talking all the time. I can tell you with our unsheltered population, nighttime is when you see the most, because they're trying to survive. They're scared to go to sleep, so then they're using methamphetamines to stay up for survival. And you'll get your common side effects that come with those: the chest pains, the scare, the paranoia. And that's just a survival technique, unfortunately, is the substance use. So it's making programs and resources available to our community. I think that will reduce those ebb and flows, right? Those holiday, those seasonal, there's hourly things, but yeah.
Yeah, so see, it's not just weather seasons, right? It's seasonalities in our life, you know, as she pointed out. You know, the adolescents are going through the season of change and really figuring out their next steps into their 20s, and and then there are, you know, other things, even businessmen. I mean, I can think of a couple off the top of my head that are struggling in that season. Maybe it's midlife crisis, a lot of pressure at work, really understanding what their next steps are. So I love that you put it in that perspective, Mandy.
I think the biggest surprise for me was business owners during tax time. During tax time, I guess the alcohol industry booms with business owners as their number one buyers, because it's stressful. That's stressful time. And just going back to that unhealthy coping skill that people like, this is stress, so let me just take the stress off by either using a substance or buying a bottle, whatever the situation is.
So yeah, there might be like different like times where you see more of one thing, but like we said before, it really is, it doesn't have an age. It doesn't have a certain group.
No economical class, no age, no race, no nothing.
Well, I love what you guys are doing in the community. I really didn't expect to have teary eyes today, but it really, really touches me, because I've had a personal story as well, you know, and just know that this really does help. Your guys' program really does help. But we usually kind of end with a piece of advice. Could each of you guys share a little piece of advice of anyone that's maybe struggling, or anyone that's scared to reach out for help?
Now I'm going to get teary-eyed because I do believe hope lives. I do.
Absolutely.
Even in the emergency department, right? It's such a scary space. But it's the simplicity of that space that we can offer exactly that, which is hope. No matter what that looks like, and no matter what the issue is or what the struggle is, we can offer that hope.
I mean, always going to touch on the hope, like Tracy said, but just knowing that there's someone there. There's someone there to help you navigate that process. You're not alone. You'll never be alone. Even when you think you've burned all your bridges, there's still someone there that cares and hopes. So just being open to those services, reaching out for help. Support is the biggest thing, and it's there. So just reach out.
Awesome. Well, thank you guys so much again for being here. And I love what you guys are doing.
We love it too. And thank you for having us.
Yes.
Thank you for having us.
Yes, of course. Thank you, everyone, for tuning in to another episode of Shattered Silence. As always, don't forget to follow us on all of our socials on Facebook, Instagram, and TikTok. You can watch full episodes on YouTube, or you can listen in on Apple Podcast or Spotify. I always do my car. This is a paid message from Amelia Malloy's Angels. Did you know that 1 in 6 couples struggle with infertility, often facing emotional stress and the high cost of treatments? That's where Amelia Malloy's Angels, a nonprofit organization, steps in. Serving Kern County since 2022, Amelia Malloy's Angels provides family grants, comfort kits, and monthly support groups that bring hope, financial assistance, and spiritual care to couples who need it. If you would like to support families walking through infertility, you can become an Angel of Hope with a minimum monthly gift of $25, join their prayer team, or sponsor or host a monthly support group. Visit their website at www.ameliamalloysangels.com.